Clinical physiology is a branch of physiology that focuses on the application of physiological science in medical and clinical contexts. It involves the study of the functions of the human body in normal and pathological states, with the aim of detecting, diagnosing, and designing treatments for various diseases. 1. Definition of clinical physiology. Normal physiology. Understanding how the body works in a healthy state. Pathological physiology. Studying changes in body function due to disease or disorder. Primary goals. Bridge basic physiology with clinical practice. Develop physiology-based diagnostic methods. Adjust therapy based on impaired body function. 2. Scope of clinical physiology. A. Functional diagnosis. Clinical physiology uses tools and techniques to evaluate the function of organs and body systems. Examples: spirometry, measures lung function. Electrocardiography, ECG, evaluates the electrical activity of the heart. Glucose tolerance test, assesses the body's response to glucose to detect diabetes. B. Patient monitoring. Monitoring vital functions such as blood pressure, oxygen saturation, and heart rate. Use of technology such as ventilators to support compromised physiological functions. C. Physiology-based therapy. Pharmacological therapy. Drugs that affect specific physiological pathways. Example: beta blockers to control hypertension by decreasing sympathetic activity. Non-pharmacological therapy. Physical rehabilitation to restore muscle or nerve function. Breathing exercises to increase lung capacity. D. Clinical research. Study of how body functions change during illness or treatment. Using clinical trials to evaluate the effectiveness of new therapies. 3. Application of clinical physiology to body systems. A. Cardiovascular system. Normal function. Pumping blood to transport oxygen and nutrients. Disorders: hypertension, high blood pressure due to impaired pressure regulation. Heart failure, decreased ability of the heart to pump blood. Diagnostic methods: ECG to detect arrhythmias. Echocardiography to evaluate the structure and function of the heart. B. Respiratory system. Normal function. Exchange of gases, oxygen and carbon dioxide. Disorders: asthma, narrowing of the airways due to inflammation. Chronic obstructive pulmonary disease. COPD, chronic airflow obstruction. Diagnostic methods: spirometry to measure lung capacity. Oximetry to monitor oxygen saturation. C. Endocrine system. Normal function, regulates metabolism, growth, and body functions through hormones. Disorders: diabetes mellitus, disorder of blood glucose regulation due to insulin deficiency or insulin resistance. Hypothyroidism, insufficient production of thyroid hormones. Diagnostic methods. Blood tests to measure hormone levels such as insulin or thyroid. Glucose tolerance test. D. Nervous system. Normal function. Regulates communication between cells through nerve impulses. Disorders. Epilepsy. Abnormal electrical activity of the brain. Stroke. Disturbance of blood flow to the brain. Diagnostic methods. Electroencephalography, EEG, for electrical activity of the brain. MRI for imaging brain structures. 4. Methods and techniques in clinical physiology. A. Diagnostic imaging, MRI and CT scan, detect changes in the structure and function of organs. Ultrasound, used to evaluate soft tissues such as the liver and kidneys. B. Direct physiological measurements, cardiac catheterization, measuring blood pressure within the heart. Blood flow measurement, using Doppler to evaluate circulation. C. Dynamic functional tests, tests that evaluate the body's response to certain stimuli. Treadmill test to evaluate heart capacity during physical activity. Bronchodilator test to determine airway response in asthma patients. 5. Clinical physiology in disease management. A. Chronic disease, management of hypertension with diet and antihypertensive drugs. Use of insulin pumps in patients with type 1 diabetes. B. Acute disease, management of shock with intravenous fluids and vasopressors. Management of acute respiratory failure with mechanical ventilation. C. Rehabilitation, cardiac rehabilitation, exercise and education programs to restore heart function. Pulmonary rehabilitation, training COPD patients to improve respiratory function. 6. Role of technology in clinical physiology, monitoring devices, real-time monitoring of blood pressure, ECG, and oximetry. Biofeedback, helping patients understand and control certain body functions, such as heart rate or blood pressure. Telemedicine, allowing for remote physiological evaluation. 7. Applications in various medical fields. A. Cardiology, understanding the pathophysiology of heart failure to determine optimal therapy. B. Pulmonology, evaluating lung function before and after therapy. C. Neurology, determining nerve conduction disorders for the diagnosis of neuropathy. 8. Benefits of clinical physiology, improved diagnosis, helps detect disease earlier, therapy optimization, adjusting treatment based on individual body function. Medical research provides a scientific basis for the development of new therapies. Conclusion: clinical physiology is an important discipline in modern medicine that helps understand the relationship between normal body function and disease. By integrating basic physiology into clinical practice, clinical physiology enables more accurate diagnosis, more effective treatment, and the development of better medical technology.